Goodson. Here. Bedard. Proctor.
Here.
Berger. Here. Valdez.
Here.
Garcia.
Here.
Thank you. We have a quorum. Would everybody please stand for the Pledge of Allegiance? Ready? Begin.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. We'll now be moving on to item 4, consider approval of agenda. In the case of an emergency, items may be added to the agenda by a majority vote of the Board of Directors. An emergency is defined as a work stoppage, a crippling disaster, or other activity that severely imperils public health, safety, or both. Items on the agenda may be taken out of sequential order as the priority is determined by the Board of Directors. The Board may take action on any item appearing on the agenda. Do you have anything to add tonight? Do you have a motion to approve the agenda?
I so move. I second.
I have a motion by Goodson and a second by Berger. All in favor?
Aye.
You know, if you wanted to take the concept,
Whoever that is, can you please put yourself on mute? Now we're going to move on to item 5, public comments. At this time, the board will hear comments on any agenda items. If any persons wishes to be heard, he or she shall stand, address the president, identify themselves, and state the subject or the agenda item for comment. Time limit for each speaker is 3 minutes. A total of 15 minutes shall be allocated for each item. Do we have anybody here to make a public comment?
My name's Kevin Smith, I'm from Raleigh.
Excuse me.
There's something that,
Can you turn on your microphone, please?
Okay, you got it.
oh, okay, Kevin Smith from Raleigh. Came to our attention recently that there's a conflict in AB 918 in the California Health and Safety Code, sections 32100 and 32100.01. 32100 establishes the number of healthcare district board members at 5. You currently have 7 board members. You can increase your board. Item 32100.01 explicitly requires a vote of the people to increase your board to 7. So you might want to look into whether or not you guys are actually operating legally as a board of 7 instead of 5. Thank you.
Do we have any other public comments tonight? Seeing none, we'll move on to the consent calendar. Any member of the board, staff, or the public may request items from the consent calendar to be removed for discussions. Items so removed shall be acted upon separately immediately following approval of items may be on the consent calendar. Do you have a motion for the consent, to approve the consent agenda?
I so move.
Second.
I have a motion by Berger and a second by Proctor. All in favor?
Aye.
Moving on to item 7, board comments, reports on meeting and events attended by directors, and authorization for director attendance at upcoming meetings and events. Do any of the directors have anything to report or comment?
I do. Thank you for everyone for coming here today. But I intend to go up in the next 2 weeks up to the Salton Sea area to meet with people up there and also the Calapan population to hear their concerns about the healthcare district and
Can whoever is talking and on Zoom not put yourself on mute, please? Do you have any other director reports or comments? Seeing none, we'll move on to item 8, discussion and/or action items. Item A, discussion and/or action approve contract with demographer for districting plan development and creation of district maps or alternative.
Thank you, Madam Chair. Good evening, everyone. I'll take that one. So pursuant to the board's direction at the last board meeting, I solicited some proposals from demographers for consultant work that would create maps for the election districts required by AB 918. I got 2 proposals, which were included in the agenda packet. One was from the National Demographics Corporation, and the other was from the Redistricting Partners. Both are for consideration tonight, and the agenda does also contemplate alternatives. There's a couple of alternatives I wanted to bring to this board's attention. First, let me speak about National Demographics Corporation. National Demographics Corporation's proposal is the lower of the 2 in terms of cost. I've worked with them before. I worked with them when we created district lines for Tri-City Healthcare District in San Diego County. They went from at-large to 5 districts. And I found their work to be super competent, and they're very capable and expressed an ability to jump on this quickly. As you know, we have a looming July 1 deadline, which requires this board to adopt a resolution establishing districts by no later than July 1. You would have to have at least 1 public meeting before then to show the public and consider for consideration with this board the potential maps, the districts, the demographics in each of the districts. Another option that I thought would be prudent for discussion today is if, I'm going to take over the screen here and show you. So the other option for consideration is, thank you. So this is the boundaries of Imperial County. This is the handy Argus website that Imperial County has. And so here's your hospital districts, right? There's Pioneers and there's Heffernan. There's a number of agencies that are here on the list. The only agency that has 7 trustee areas consistent with the 7-member board and the same jurisdictional boundaries as IVHD, which is the County of Imperial, is the Imperial Valley College District. The Imperial Valley College District, I looked into it, and they went through the redistricting process after the 2020 census and adopted a new district map, which is the map you see up on the screen, on February 16th, 2022, so pretty recently. According to the documents we found on IBC's website, their redistricting consultant, they retained them in September and adopted the new map in February, so that entire process took about 5 months, and the maps were vetted through 5 public meetings. So something you may want to consider, or you want to discuss as a board, is whether you want to piggyback off of those districts. Since they were adopted pretty recently, I had a quick look at the resolution that established those districts, and the resolution properly considered whether the trustee areas were geographically contiguous, whether they preserved and respected the geographic integrity of local neighborhoods and local communities of interest, that the trustee areas were easily identifiable and understandable by residents, that they were geographically compact and balanced in terms of total population and voting age, and that they conformed to concentrations of minority voters. In other words, they didn't split minority groups, which would be about a violation of the California Voting Rights Act. So it's worth discussing whether you are interested in potentially piggybacking off of their districts and adopting a resolution that mirrors the college districts. Because if you wanted to do that, you arguably wouldn't need to hire a demographer. You could bring a resolution to this board in the next couple months. We could propose the same maps and definitely get it done by July 1. The downside of that is, 2022 is very recent, but it's not 2024. So if you did hire a demographer to do the work now, you would have more current data with respect to communities of interest and probably not population because they're going to use the 2020 census anyway. And, you could have more of a say over where the districts are. So if you didn't want to simply adopt the same districts as IBC, if you wanted to have some more time to look at the communities and say, well, actually, I think we're not considering this or considering that, and allow the public to participate in that process too, you could say, hold on, let's get a demographer, let's do it from scratch, and if they end up coming up with the same, districts, great, and if they don't, let's talk about it. But I just wanted to throw that out as an alternative for your consideration. So what the board can do at this point is give legal counsel and Mr. Buchanan direction with respect to next steps. Either retaining one of the two proposed consultants that we have a solicitation from, or giving us direction to move forward with pursuing an overlap of districts with the community college district.
I had a question about that, because also the Board of Supervisors also has district lines as well. Do we have a map on that? And
Sure.
How similar is that to that IDC map?
So the difference is the Board of Supervisors are 5, I believe,
Okay.
instead of 7. But that I can throw up if you'd like to see them. This is Imperial County, but no, this is the voting precincts.
I think you answered my question though. with
Okay,
5.
yeah, yeah. So here is 5.
Yeah.
There's only one that's countywide, that's 7.
I have some thoughts on that. So we've had a few presentations provided to us as a board and as a community, and what I think that in order to be consistent with what we've been doing is maybe having a demographer so that we have true numbers as opposed to numbers that were gathered by somebody else. That's just my opinion.
Do you have any other comments, questions from the board?
I would echo what Director Proctor just said as well.
So would I.
Do we have a motion to choose one of these things? Or do we want
After reviewing both packets, I make a motion to move forward with the National Demographics Corporation. I thought their package was more robust, and the cost effectiveness of their proposal also was I think, good as well. So that would be my motion.
Okay, so I have a motion by Garcia. Or do we have any comments from the public? Seeing none, I have a motion by Garcia and a second by Berger. All in favor, please say aye.
Aye.
Thank you. Now we move on to item B, discussion and or action of the presentation of the Kaufman Hall study.
Oh, no, sorry, 8B,
8B, yeah, 8B.
discussion and or action with legal counsel, right?
No, I think mine's actually pretty wrong.
Oh, I have a different one than you do. Mine says agenda final, but what's on the public one? My 8B is the discussion with legal counsel.
That's what it's supposed to be.
Yeah, I
Okay,
have the same thing as. Discussion on competition.
I have copy.
Yeah, but this is different than, this is what must be. You can reorganize the agenda if you want to take it,
Okay.
because it's clear from the confusion that there's maybe 2 versions. Same agenda, just flipped, B and C are flipped.
Okay,
So if the board would like to entertain items, discussion with legal counsel first, or the Kaufman Hall study first, I prefer you.
let's do the discussion with legal counsel first, if everybody's okay with that.
I agree.
Okay. So we'll go on to item A, adoption of regular meeting schedule.
Yes. Thank you, Madam Chair. So I'm going to try to get through these 5 sub-items rather quickly, but feel free to slow me down anytime you want. The first is, and forgive my ignorance because it's my second meeting, I recommend the board adopt the regular meeting schedule if you haven't already through a formal motion and vote. Usually what you would do, and what I recommend you do next year, is in January at the first meeting of the year, you bring a calendar. It's like a one-pager that says regular meeting schedule for the year, and it lists all the dates so that at the very beginning of the year, the board will know when the regular meetings are. It's always the second Tuesday or third Thursday of the month at 6 p.m., whatever schedule you want to adopt, so that both the board and the public have clarity with respect to what regular meetings are. Of course, the board can continue to have special meetings in between, but I wasn't sure whether there was a regular meeting schedule adopted yet, and if not, then I recommend you adopt one at this board meeting. There are certain things that you cannot do at a special meeting that you can do at a regular meeting, so it's important to have that clarity about whether meetings are special or regular.
I thought that at our first meeting, we decided on the second Thursday.
Did on the Thursday, yes.
Yeah, okay. So do we want to, let's just stay,
Formalize it maybe?
formalize it, so do I have a motion, and then we can have.
I move that every second Thursday we meet, or whenever.
6 p.m.
At 6 p.m.
Yes, 6 p.m. I'll second that.
I have a motion by Berger and a second by Goodsell. All in favor?
Aye.
Item B, governance training date.
Thank you. So my other recommendation, and I make this recommendation every time I have a brand new board or a board of a new entity that's being set up, is I recommend a governance training. It will be a public meeting, open to the public, agendized, but the purpose of the meeting will be to train the board on the most recent developments with respect to public meetings, closed sessions, the Brown Act, ethics, obligations, and conflicts of interest. So with respect to the government's training recommendation, I've created this, what I hope to be handy binder for the board members. There's a copy in the back for the members of the public, although the copy in the back doesn't have the contact information just for privacy reasons. But this binder has board member information up front, then it has ethics information. You can see we just created like a one-pager that informs the board or reminds the board that you have to receive at least 2 hours of ethics training every 2 years. There's ways to do it that are free and online, and there's ways to do it that are in person. And I'm also recommending governance training. The third tab is the health and safety, the healthcare district law. So because we are a healthcare district, this is the law that's going to govern the actions of the board. Behind that is AB 918. Which is the principal act that created this agency. Behind that is the Brown Act. And the Brown Act this is our Procopio's and proprietary, it's like a cheat sheet on the Brown Act. And it is the actual language of the Brown Act. It's just organized in a way that makes more sense, because if you tried to look things up online, it's like a mess. So this has a handy table of contents. We always do a primer at the front page on like what's new, what changed, the newest bills. So hopefully this is a handy way of answering any quick questions you may have, like what's a meeting or what's a quorum or where are the closed session descriptions, etc. And then in the very back is the conflict of interest form. So this Form 700, for those that aren't already familiar with it, is a public filing that all board members are required to fill out within 30 days of assuming office. So for any members of this board, if you haven't already filled it out in an assuming office capacity, I encourage you to do that. But this is the kind of stuff that I would go over in a governance training, the whys, the how do I do it, what are the deadlines, by when, so that this board is up to speed on the latest requirements for public officials. So my ask is that if you are inclined to do a training, that we set a date. At some point in hopefully the next couple weeks, so we can get it on calendar, prepare, and then it would only be a training. And usually these trainings are about probably an hour to 90 minutes.
Do we have to make a motion on it right now, or can we send out like a?
You don't have to make a motion. I am interested in knowing whether this is something that the board would like to do. If so, I can reach out offline and do a little poll on dates and times. It would have to be in person because it's a public meeting under the Brown Act. So we can't do it online. but is that something that you'd like me to do?
Yes.
Okay, so I'll reach out with these following this board meeting. So item C is review of the preliminary district roadmap. Something I handed out to the members of the board that I did not provide for the members of the public because it's attorney-client privileged communication, but we can discuss it in an open session, is this preliminary roadmap that we discussed at the last board meeting. So this is actually still in really preliminary form, even though it's 6 or 7 pages long. But this is really just AB 918 put into a timeline. The first 2 recommendations are, the first 3 are recommendations, not mandatory. And you'll see the first one you've already done, which is retain a demographer, consultant to assist with drawing the election districts. The second recommendation, which I recommend you do either at this meeting or at the next meeting, is appoint a negotiation team for the merger and acquisition of the hospital. So my M&A team at Procopio has already started to compile bond transcripts, etc., relating to potential acquisition of ECRMC. First things first, we have to start getting the list of, a term sheet together with Heffernan and PHMD, PMHD, relating to the, I want to say acquisition, but the succession, because it's going to be a succession and a dissolution of the hospital and the urgent care. We're going to need to be very fast because of the deadlines, and we're going to need to be pretty flexible. So my recommendation is to create an ad hoc committee. An ad hoc committee is less than a majority of the board, and its board members. It can be 2 or it can be 3 in this case. And they would be the committee tasked with giving recommendations regarding the negotiation, participating with the negotiation team, the lawyers, the discussions with the various parties. Ad hoc committees have no decision-making authority. They only make recommendations, they come back and they report to the board. If we form an ad hoc committee, you would be able to meet over Zoom. You wouldn't have to meet in person. They're not publicly noticed meetings, so you wouldn't have to comply with the 72-hour agenda provision. It would allow for some confidentiality with respect to the negotiations with the various parties. And most importantly, it would give us the ability to meet kind of quickly and be flexible about when we're meeting so that we can move forward with the negotiations and try to push to meet these ambitious deadlines. So I recommend the board form a negotiation team, an ad hoc committee of 2 or 3 board members. If you're prepared to do it today, you can. If not, and you'd rather hold off until the next board meeting, you can. But that's my recommendation in order to start meeting some of these deadlines that you see on the roadmap.
So I just have a question about that. Since 2 of our board members sit, one sits on Heffernan board and one sits on PMH board, would they be allowed to be on those negotiation committees?
So legally, they would be allowed. I would recommend against it, but because of 2 things. One is perception. The perception of the public would be, oh, that's not a true neutral negotiation team. And that perception would, I think, potentially extend to board members as well, is, oh, so-and-so is unable to be unbiased or has, personal feelings at play. And I also think it can be uncomfortable for potentially staff that we're speaking to when we start engaging in these negotiations if the person on the other side of the aisle talking about terms, talking about acquisitions, is someone who's part of their organization. So I do think, my recommendation is that if you form an ad hoc committee of 2 to 3 board members, the representative from Heffernan and the representative from Pioneer not participate in the ad hoc committee, just because of the potential perception of a conflict of interest.
How soon would we start meeting if we chose that ad hoc committee today?
Next week.
Next week?
Yeah, as soon as next week, because we're ready to get up and running.
Yeah.
We have spoken to we have our M&A team kind of ready to start pulling terms from AB 918 to create a term sheet for IBHD. We need to reach out, and I've already had very fruitful discussions with the city of El Centro because they reached out to me. I've had discussions with LAFCO, the CEO of LAFCO, relating to the districting and other timelines. Very fruitful discussions there too. But what we really need to do is get our regulatory council online, which the healthcare attorney, we work with a firm out of LA because that's a different specialty, and it is a specialty. The regulatory compliance is a compliance portion that's always changing. For example, I think there was a bill like SB 184 or something that came out that's in 2022 about the Department of Public Health and the oversight of the Department of Public Health over mergers and acquisitions specifically. So it's a tricky area, but our team is assembling on the legal side, and so we need the decision makers to start assembling on the policy side. It's no problem if we can't meet for a few weeks, but the sooner the better, in my mind.
I would like to make a comment. I do disagree with you about representatives from PMH or Hefferman, because I mean, we were appointed to this board for a reason, and I feel that we're being discriminated against because we sit on those boards. I understand your perception, and I understand your theory, but we took this oath totally unbiased, and therefore, if we felt that we needed to sit on a team, I think we should have that option. I think we should not be excluded. So that's my.
I have two things. Number one, listening to Mr. Smith, being ignorant to these health and safety codes that he mentioned, I am concerned, number one, that we need to address that so that the public knows that we're in compliance with what he mentioned. And then the other issue is we're missing one of our board members. Can we reach out to him, although he's not here, and ask whether he would want to be part of the ad hoc committee, or does he have to be here?
So to form the ad hoc committee today, what you need is a motion and a vote of at least four of you, to be on board with whoever you're appointing. You could, for example, appoint the absent member to be on the ad hoc committee, and they wouldn't be here to say yes or no, but you could say, we appointed you to an ad hoc committee, and if that person decides they don't want to be participating, we can revisit it at the next board meeting. But the short answer to your question is no, you can't decide, you have to make the decision at a public meeting. The appointment has to happen in open session.
Do we want to vote on this right now? Do I have any nominations?
I'd like to put my hat in the ring to be part of that.
Hello? Hello?
Can you please put yourself on mute?
Is there any time we can raise our hands?
Not right.
Yes, ma'am, but I haven't asked for public comments yet.
Thank you.
I mean, I don't know. I think, it's up to the board. We can, if somebody's interested and they come back, we can, whatever, it doesn't matter to me either way, but I think the sooner we get negotiations, the better.
You know, an idea is if we're gonna have governance training in, say, 2 weeks, if we manage to find a date in the next couple weeks for it, it's gonna be a publicly noticed meeting. So we can put at the very front end of that agenda, appointment of a negotiation team, and that way we're not waiting until next month. You know, it's happening kind of in between, and then folks have an opportunity to maybe talk, and we have potentially a full board. It's something to think about, but it's at the board's pleasure.
Do we have any other comments from the board?
I think it should be 3 members, and those who should be on the board.
I would like to be on the negotiations committee as well.
So maybe we should just wait until Donald is present as well. Or do you want to go ahead and do it?
My thing is, if you miss a board meeting,
Oh, okay.
we can't, here's my thing is, we're on such a time crunch, we can't wait, we waited for James to get on and we kicked that can already. We're waiting for Donald misses a meeting, we kicked that can already, and we don't have time to sit around.
I agree.
Is kind of my thoughts on it. But obviously it's up to the board.
Because this was kind of a surprise to me. Unless I missed something on the agenda. I mean, would Donald have known we were gonna be making this decision tonight based upon the agenda?
Well, it's relating to the district's roadmap, and the board can form its ad hoc committee relating to the items on the district roadmap, but no, I mean, so you could, if you wanted more clarity for him, we could kick it out to the governance training special board meeting and then have a very clear, agendized description of consideration and possible formation of an ad hoc committee for negotiators. But this is not, it's not a decision-making, the board wouldn't be deciding something like a contract that someone would be able to unwind, for example. So,
Yeah, as a board member, everybody, like everything that this committee comes is still gonna come back to the
Right.
board, and the board will make the decisions. You're kind of just like out there gathering their information and coming back.
yeah, it's just really like a steering committee to steer
I
the
understand the
negotiation.
concept of an ad hoc committee, and of course, I'd like to be on it as well, but I am uncomfortable making that decision when we have a board member missing, and he may or may not have known that this was gonna be discussed, if it wasn't that something that he wanted to participate with. I mean, I know something came up, and I understand what you're saying, but,
Yeah, I mean, I just think we gotta do what's best for the community, and waiting any longer isn't, we can't put everything on hold. Like, there's gonna be times where we're gonna have a missing board member. I mean, it's reality, it's just gonna happen. And so I think even no matter what, like, decisions are gonna be made, like, there might be a decision to, a board decision. But for example, like, I might not be able to make it, those decisions still have to get made, so I don't think time's not on our side to do that. I understand, I just think we need to move it.
well, I guess then my comment would be, when we have these decisions to be made, they need to be on the agenda so that every member understands ahead of time that this is what's going to be discussed, so that they have an opportunity to either try and get here or no, so sad, so sorry.
Yeah, because this was just handed to us.
It should be here
when we
legally.
got here.
And the other thing to consider is, this is just the formation of an ad hoc committee. At the next board meeting, you can dissolve it. You can form a new one. You can swap a member out. Because you're not passing a resolution or signing a contract that's gonna obligate you to something. This is just gonna get us through the next month or until the next board meeting when we can revisit the topic. And you can, in theory, you can form an ad hoc committee on any item on the agenda, if that's where the board's discussion takes you, especially if part of the agendized description is discussion. But I think it's a very good point that if this is something that's consequential and could upset a board member because they didn't know, they couldn't anticipate that this was gonna be a recommendation, we can absolutely agendize it more clearly next time, and I'm happy to do that. So again, you can always quote unquote cure it at the next board meeting if the missing board member says, I take objection to this and I want to revisit the discussion, we can put it for discussion at the next board meeting. Or maybe the board member says, I'm fine with it, good for you for passing it and moving on. I don't know, that's my 2 cents, but of course it's your decision.
Have a motion, or is there any comments from the members of the public? Anybody on Zoom?
Hello?
Yes.
If you're speaking, you've just muted yourself.
Okay, now?
Yep.
Can you hear me?
Yes.
Okay, thank you very much. One of the things that I've noticed is that I know that we talked about some things last time.
Can you please
And I don't
introduce,
see-
ma'am, can you introduce yourself, please?
Sure, it's Katie Alcanza Satian, PMHD.
Thank you.
And I was looking and comparing what we talked about last time and what you have in the agenda. And you have new things here on the agenda that we didn't speak about last time, and things that were that we agreed last time are not in this agenda, and they don't even reflect on the minutes. And so I understand that you're trying to meet deadlines and that you're trying to be due diligence as much as possible, but here you're forming a committee, and hopefully this committee will be able to get together with those two CFOs that you said that they were going to get together so they can work together at this time. Also, the mediation that was supposed to be gotten from the county, I don't know if you have received that or not. And so I hate to put the cart before the horse when you have to do all this due diligence, and I understand regarding the committee you're trying to form at this point right now. But I feel that your agendas need to be going out a little bit more days. I know you have a requirement, but at least a little bit more information to your board members, since they're the ones that are going to be making these decisions. They need to be included on that. And like I said, your minutes don't reflect some of the things that are here in the agenda. So because this is a public information that's going to go out, we're going to have to be as clear as we can and let them know exactly and be transparent of what's going on. And I agree with one of your board members that, it's very important for the secretary or whoever's making these decisions to put this information on the agenda, get together with the board members and let them know what's going on. Since it's against Brown Act for each of the board members to talk to each other, you need to have the secretary do that for us. Thank you.
Do we have any other comments?
I have a question.
Can you introduce yourself, please?
I would rather not.
Ma'am, you should please introduce yourself.
Yeah.
For the
Do I need to introduce myself?
Yes, for our minutes, you have to introduce yourself. If you were here in a public meeting, in a public setting, everyone would be able to see who you are. So the public policy is that you not be allowed to make a comment unless you're willing to identify yourself, because it's not fair to the folks that are here in person.
But then I don't have to sign in or anything, so why would they even know who I am?
Well, they would see your face is the idea. You just need a name.
Do we have any other public comments? Seeing none. Do we have a motion to appoint people, to table it, whatever is on the table for anybody?
Well, I do think time is of the essence, in echoing what everybody said, of course, but I think we all know the magnitude of this and the workload ahead of us. If you miss one meeting, you're going to miss a lot, no matter what, and so I think we move forward. So it sounds like we have 3 individuals on our board now who are willing to participate in the ad hoc committee, so I make a motion for the 3 of us, myself, James Garcia, Katie Burnsworth, and Laura Goodson, the one I know the most. Sorry, I get nervous talking in front of people. And that would be my motion to create the ad hoc committee and get moving forward as fast as possible.
I second that.
All in favor?
Aye.
Aye.
Here, everybody. Is there anything else for the preliminary roadmap?
No, thank you. The next item is the prioritization of district policies. And we talked last time about starting to plan out the adoption of district policies so that we can be a little bit more organized and up and running since there are no current bylaws or policies. So at the very end, on page 6 of your roadmap, I have a recommended policy list for the benefit of the members of the public. It says next board meeting date, CPD. We know what that is now, but I just don't have my calendar up. Here's a couple of the policies that I recommend that we bring back to that board meeting so we can start adopting them. We can do all of them at once. We can do 2 per meeting, 3 per meeting, 4 per meeting, whatever this board is willing to entertain. But I do think having bylaws is important. I think having a conflict of interest code, which is required by the FPPC, will be important. A business expense reimbursement policy. I don't know if board members are receiving compensation for attendance at board meetings, but if you're not, you probably should be. because most public officials receive compensation for their attendance at meetings. So you cannot get compensation until and unless you've taken your governance or your ethics training and you've adopted a written policy about board member compensation. And then having a policy regarding the duties and expectations of board directors. So I put those 4 as tentative policies I could bring back to the next board meeting. And then the following board meeting, a comprehensive code of conduct, maintenance of confidentiality by directors, and public comments at board meetings. And public comments at board meetings would actually help to address situations like we just dealt with on the Zoom with respect to what the expectations of the board are with respect to public comment, the difference between virtual and in-person attendance, because of course virtual attendance is not required by law. It's a courtesy that the board is providing, which is great and important for the public. So sussing out those details, because you have a very involved and active community, I think is important. I could probably list 16 more policies, but I just decided to start with these 7 and see if you would like me to bring these back in this order, reorganize them, do 2 per meeting, do all of them at once, at the board's pleasure.
Any comments from the board, questions?
Personally, I agree on the conflict of interest code train, because we have, like you mentioned, 2 members that are on the Heffernan and one PMA. So in the spirit of being transparent with the community, I want to make sure that they know that when it comes to instances of us voting, that they're going to be in compliance. And I feel more comfortable that they are part of our decision making than
I think all 4 of these, we should be able to do in the next meeting.
So the first 4? Or
Yes.
Okay. And then have the last 3 for the following one?
Yeah.
Okay. So is that your motion?
Sorry. Except first 4.
Sorry.
Do you have any other comments or questions?
So for clarity, the motion is to bring back proposed bylaws, conflict of interest code, business expense reimbursement, ethics training, and duties of the board of directors policy for the April board meeting.
Correct.
Okay.
Do you have any members of the public that would like to comment? Please step up to, either of you, step up to the podium.
Good evening, John Graff from Brawley. I'm just asking if the board would approve making the roadmap public. I understand it's a private document at this point in time, but with the board's approval, that could be made public.
I don't see it being wrong. I don't know how you guys feel about it.
You're welcome to waive the privilege if you're inclined.
I agree with Anola. That way the public can see that we're actually working towards a common goal and kind of see where we're progressing.
Right.
I think it's a good idea for everybody to know where we're at this point and where we're working.
Regarding my name is Tina Geary from Brawley. Regarding the last motion you just passed, since it's about governance, your bylaws, code of conduct, duties, reimbursement for the board, could you spend a few minutes at your governance training and take care of those 4 so that you can move a little faster? That was my suggestion.
Thank you. Do you have any other public comments? Do you have a motion or?
I think you have a motion.
Do you have a motion?
I have a motion to allow the public to have a copy of the roadmap.
A second.
All in favor?
Aye.
So I will, I don't have copies available for the public right now, but I'm happy to make them available. I don't know how you don't have a website yet.
We do have a website.
Okay, great. So they will be uploaded to the website as soon as we can. The roadmap.
And they'll have draft on them.
It's, So yeah, I think it's fair to say it's a working draft because as we continue to flesh out the requirements of the state regulations with respect to the hospital merger, more dates may get added to this. So it will be what I like to call a living document, like a working draft, but every time that it's updated, we'll bring it to the board, and if the board's okay with disclosing it to the public, we'll keep on uploading it to the website.
Great, thank you.
I don't know if we voted on did we vote on the policies?
We did not. Yeah. Do we have a motion and a set? Okay, so I'm doing housekeeping. Back, I had a motion by Berger to approve the 4 policies listed, and I have a second by Garcia.
I'll second now.
Okay. Sorry, oh, okay. I'm just trying to make it so our secretary, our clerk has minutes. Okay, so all in favor, say aye.
Aye.
Thank you. Okay, and so now we'll move on to item E, Imperial County LAFCO public hearing, March 28, 2024.
Yes, so I had a discussion with the CEO of LAFCO, Imperial County LAFCO, and it was brought to my attention that there is going to be a public hearing on March 28th, 2024, regarding both the proposal by Pioneers, which is for consideration by LAFCO at the hearing and was continued from a November hearing. And there's also an item on the Imperial County LAFCO agenda for discussion of IVHD. So IVHD is a discussion item at their agenda. In my conversation with the CEO of LAFCO, it was made pretty clear to me that LAFCO would like input from this board and would appreciate knowing the position of the board with respect to the proposal. I had a look, and I'm going to admit this is kind of like drinking out of a fire hose right now because there's a lot of legal issues coming at me in the past 2 weeks or 3 weeks since I became legal counsel here. But from what I could glean from the proposal that I read, the Pioneers proposal and the staff report from LAFCO, and in my evaluation of AB 918, it does appear to me, high level, that there's an inconsistency between the proposal and AB 918. Because the proposal, roughly, proposes for Pioneers to take over Heffernan, and AB 918 proposes to dissolve both Pioneers and Heffernan and have IVHD take over. So I do think it would be prudent for this board to give direction at this point in time for how to approach the LAFCO public hearing. My recommendation is I think it would be prudent for this board to write a letter and make a written record objecting to the Pioneers proposal in light of the fact that it conflicts with this board's duties. I think that you were formed this is just my legal opinion, and I'm new and this is not political at all, but this board was formed to oversee the dissolution of Pioneers, the dissolution of Heffernan, the acquisition of the hospital, the urgent care, and the potential acquisition of ECRMC. And you have a statutory obligation to make sure that gets done as appointed board members. And it's my perception that LAFCO would like to hear from this board, and I think what would be beneficial is if they heard from this board that you're here, you're formed, and you intend to do your jobs, your first round of jobs anyway, which is what's required by statute. And potentially there's arguments that it is a waste of the public's funds to proceed with the Pioneers proposal in light of AB 918. I am sure LAFCO or Pioneers has their own legal opinions about that, and I'm not proposing to get into like a drag out knuckle fight over it, because this board is going to have to do what it has to do anyway, right? I mean, whether or not LAFCO blesses the proposal and approves it doesn't change your job here. But I do think LAFCO would appreciate hearing from this board. So my recommendation is to write a very high level, non-argumentative, but position statement of the IVHD board, objecting to the approval of the proposal If that's not something you're comfortable with, I do recommend you direct me to attend that hearing to give the legal position. I also recommend board members appear at the IVHD, or I'm sorry, at the LAFCO hearing to answer questions that the LAFCO commission may have, or voice your opinion, even if it's an individual opinion about the proposal. But it's important, I think, to have this discussion at this point in time because this hearing is going to happen before the next board meeting. So I just didn't want it to go by unnoticed, especially when I am kind of trying to issue spot potential legal issues. But with that, I'll open it up to the board for discussion.
Any comments or questions from the board?
So my comment is that from the very first meeting that we had, we were very clear with the public that we have a mandate, and that's what we were set up for. So our position has always been that we're moving forward. Everything that we're doing is in the interest of the public, including not just depending on the financials that were provided in these studies, like the one we're having today. There's going to be a lot of questions, I'm sure, from the public and from us, but that should give everybody in the community just confidence that we're moving forward. We're not trying to delay any of the things that we're doing. We're just trying to research, gather information so we can make the best decisions possible so that we can fulfill our mandates. That's all I have.
Do you have any other comments?
I fully support what our legal counsel just said. I fully support writing a letter stating our position and what our mandate is to do and our commitment to fulfill that mandate for our community. And if the board agrees too, I think it'd be very powerful to have our attorney present at that meeting as well.
Yeah, I think that, it's our job. I don't know how the two kind of go together with a LAFCO expansion of 2 districts, and then, at the end of the year, we dissolve them anyways. I kind of think it overlaps, and, the law supersedes an expansion. Ma'am, can you please put your on mute?
Our customers benefit from over 120 years of window making excellence. And because of our size and expertise,
So also if you click on participants on the bottom and the column on the right hand side, and then you can see who's not on mute, and then you can just select them for mute or not. So whoever's not on mute, you can select them and ask them to mute or just mute them.
They're all on mute.
On the very bottom is mute all. Thanks.
Do you have any other comments from the board, or I want to say James?
Yeah, I also agree with legal in sending a letter to LAFCO in opposition of Pioneers expanding. And I think that's a good idea. And also to have legal present if possible.
So that's the second.
Is that a second?
Yeah.
Is that your motion?
Yeah,
Yes,
my motion.
Okay. Do I have any comments from members of the public?
Second.
Please step into the meeting.
Good evening, Madam Chair and the board. I'm Keith Bradkowski, I'm a registered nurse. And one of the things that we need to talk about that this is going to be a very important part that this district healthcare will oversee is quality of care. And if you want to give one example of going to the board LAFCO and giving them the reason why we disagree with LAFCO moving forward, I'll give you one reason. And the reason is based on quality of care. If you look at the Leapfrog Group, which is a nationally recognized healthcare nonprofit organization that evaluates quality of care, here we have the first one is Pioneers Memorial Healthcare District. Since 2020, it's gotten grades of D's and 2 F's. It's graded twice a year based on a multiple number of healthcare measures. And I'd be more than happy to spend some time at some point with the board in educating you about healthcare quality. So you have for the past, since 2020, D's and F's for quality of care for pioneers, and for Central Regional, you have C's and D's. Okay. Now, why is this important? It's important because the federal government, as well as insurance carriers, use this information in reimbursing hospitals for care. So if you have poor quality scores, you're going to get less reimbursement. So this plays an important part in the continuation of any healthcare district. Thank you.
Do you have any other public comments? Please step up to the podium.
Good talk. Ryan Kelly, 448 Wilson Road, Raleigh, California. The last meeting it was requested that the mediation information be shared with you, and that we asked that Heffernan and El Centro Regional and the Assembly Member's Office make that allowance so that it can be shared with you and the public. Waiting to see that because it does bear on what you're speaking about at the moment, as that all those entities were in a room and agreed upon a moving forward principle. That should be known before you take action with LAFCO. Thank you.
Do you have any other public comments?
You know somebody, maybe they could fix this.
I agree with the supervisor.
Don't forget to turn the mic back on.
Supervisor Brogan. Okay, one of the things that I see the value in the application having a placeholder, so to speak, is to address the fact that in the bill did not provide any provision for if in fact the ballot initiative fails. If the ballot initiative fails, you've got 2 dissolved hospital districts with no funding source. So at that point in time, what do? Personally, I see the application for expansion as a backup plan B in case that eventuality were to happen, that the effort to consolidate the districts can move forward, but would have a methodology to do that. If you have the ballot initiative fail, basically AB 918 is dead on arrival. So that's just an idea, just an opinion at that point. Thank you.
So I have a question for our legal. So when we move forward with AB 918 and we dissolve PMH and Heffernan and put them into IDHD, do those, because both of those districts pay property taxes to fund them, will those taxes go away?
Those taxes will be directed to IDHD.
They will be redirected to IDHD?
Is my understanding, but we have to, I mean, that's part of the LAFCO process too, is getting with LAFCO, and they have, oh my gosh, the term is escaping me, but they have resolutions, it's precisely that, property tax resolutions, which before the determinations are made, dictate what portions of the property tax revenue are gonna go to which special district. And so part of the determination that we do in collaboration with LAFCO for dissolution of the 2 healthcare districts would be that will be answered as part of the potential the dissolution process that we have to go through under AB 918.
Yeah, so that's going to be decided by the board and LAFCO.
Okay.
But that's a later date.
Yeah. No, I'm just asking if it's like, legal, because,
Presumably the answer is yes. You
That-
would get the property tax.
that you would get those property taxes? Okay.
So my question also too is the mediation. I'm asking legal counsel that one. There was mediation previously. Is that going to be a problem for us as well, Barb?
I'm not aware of what mediation you're talking. I don't see mediation as a requirement in AB 918.
No, there was a mediation for the Pioneers request. I guess there was a group of all the representatives sitting in a room together.
Okay.
And they made an agreement. So is that going to be an issue for us?
I don't think so. I don't know. It didn't come up in my discussion with the LAFCO CEO. The mediation itself didn't come up. And mediations typically are confidential. So I don't know is the answer. But I don't see it as being, I don't see any basis why it would be an issue for this board because there's no requirement to participate in any mediations that AB 918 sets out. So I think it would just be at your discretion whether or not.
Because I know that Donald had asked for the mediation report.
I would be surprised if someone produced it unless there's some understanding that I'm not aware of that made the mediation public, because typically mediations are protected by the mediation privilege.
Let me talk to that. You get a slip there.
It's all good.
My name is Nicholas Aguirre. I'm a retired nurse practitioner, family practice. I've worked at Pioneers Memorial Hospital. I'm on the board. I'm the person that requested to the county supervisors to seek some mediation between El Centro and Brawley. And it was to legal counsel that day, and the chairman had approved it. The chairman's back here. Okay, so did it happen? I'm not too sure. I was hoping that it would happen. Okay, and I think I remember LAFCO, the last LAFCO, where they held it the 28th. Okay, they requested mediation between the two facilities if you look at their meetings. Okay, so mediation is very important. The safety net for this board is what we're trying to do with LAFCO. We seek LAFCO initially before El Centro came to us requesting a merger. We requested a merger with them. Okay, but there were 12 amendments on 918 that really took it and really graded the 918. That was good work on that team, okay, because we're talking about merger, and I hope it happens in my lifetime. Okay, so merger is good, but we got some hassles. We got financial hassles. Okay, and this is why I seek to you, the board, the last meeting, to have El Centro share financials and Brawley share with El Centro so that we can see, because knowledge is power, and we know how we can help El Centro with retirement, with their debt. I mean, it's a big debt. They're talking about over 100 million. Okay, we're identical to, is it Madeira, which is being sought by the UC system and Advantage, the Seventh-day Adventist. Okay, so they're trying to do the same thing with the same type of population that we have here. So we need to look at that mediation. We need to have that safety net for you, because what happens if things don't go well? All right, so it's just a safety net. LAFCO's a safety net, okay? And something that we agreed before the merger took place with El Centro. And in good faith, we said, sure, we'll do it. Okay, but transparency hasn't been there. Okay, and I'm not accusing any facility, okay? It's just we need to do a little better in sharing those numbers for you. Okay? So that's where I leave. The safety net is LAFCO and the PMH extension, okay, in case something doesn't happen. It's a lot of expense.
Thank you.
Thank you. Do you have any other public comments? Do you have any public comments on the Zoom?
Hello, this is Katie Santillan again. And just like Mr. Kelly had said, and you had agreed, Mrs. Burnsworth, that we were going to ask for that mediation information from the county where the judge was brought out. And at that time, I had emphasized the fact that Brawley had agreed to release information, and they had not heard from Calexico and El Centro. Mr. Rayton stepped up and he said that they agreed also. Mr. Kelly came at the end, and he had, I believe, texted the secretary, and secretary has at that time had not heard a response yet from Calexico, even though Mr. Rayton had said yes. So at this point, that mediation information is very important, and you said that you were gonna ask, and I don't see, like I said, it's very important that these notes that are being taken be detailed. I apologize that I was late because I was gonna speak up, and I am gonna write a letter to you pointing out some of the information that was left out, and I feel that it's very critical that the public needs to know what's going on. Thank you.
Thank you, ma'am, and I just want to make it very known that I did ask the parties to sign the agreements, and we got nothing in response from it. So it's not the lack of asking, it's a lack of getting all parties to sign on. So, thank you.
No, that was not my intention. My intention was that you did ask, and you said it right now, you didn't get any response. So, thank you very much for saying that, because it makes it very clear that as long as we're trying, they're just not responding. So it's not that we're not trying. Thank you very much.
I have a question for legal, because it seems like some of the heartburn over the mediation may be the piece of making it public. Is that something that would be appropriate to have in closed session for this board's eyes only in order, you know, if it's something that we really need to know versus going public with it, or is the only option if we see it, the public sees it?
There are many bases for closed session. I cannot think of one off the top of my head that would be appropriate or lawful for a majority of the board to meet in a confidential meeting with folks from other public agencies to discuss potential mergers. Those discussions, I think, are contemplated to happen in open session, at open meetings. There are certain provisions of the healthcare district law that do allow for closed session stuff like trade secrets, quality, you know, that's very specific to healthcare districts, and I'm just not seeing one off the top of my head. The mediation stuff is catching me off guard because, again, it's not part of this board's obligation. It sounds like it was a request made to the respective, so to maybe Pioneers and Heffernan and the city. Was the request also to have IVHD representatives at the mediation, or?
It's if I'm understanding correctly, it's mediation that has already taken place between the three entities, and there's a report with respects to that mediation, and that's what's being requested to be made public, and each entity that participated in the mediation has to sign off in order to make it public.
Sure, yeah.
That's right. Where they're not signing off to make it public. Right. So that's why I'm asking if there's any way for us to get that report in confidentiality to the parties of the mediation, but it sounds like what you're saying is we can't get the report without the report becoming public.
No, I'm sorry. I understand your question better now. So could this board get the report without it becoming public? Yes, if you sign an NDA, a non-disclosure agreement. There would have to be a good basis for that, so I'd have to think about that some more. And I still think that it would be very difficult to, for example, for this board to have access to a document. The Brown Act requires that if you have access to one document, to a document, the public does too, unless it's protected by a privilege like attorney-client or some other privilege, closed session privilege. And because you didn't participate in the mediation, you don't enjoy the same umbrella of protection. So I would have to think about it. There may be a creative way to get access to it, but I haven't thought about it off the top of my head. And I would caution this board to get too far into the weeds on mediation, because that, I understand it's related to the LAFCO public hearing, but this discussion is supposed to be about the LAFCO public hearing on the 28th. So I'm comfortable because I know it's, you know, the LAFCO is part of the mediation discussion. But if you'd like me to look into it, I have not looked into the mediation issue at all. I haven't been directed to, and I am happy to do it and see if I can figure out a way to get the mediation report to this board, if you'd like me to. I don't know anything about it.
Good evening. Pablo Velez, CEO at ECRMC. I was part of that mediation, and we all signed a non-disclosure agreement. And one of the stipulation in that mediation was that we would publish it if there was consensus among the entities that participated in that mediation. There was not consensus, at least from ECRMC part and the city of El Centro that I know of. And I made that very clear to the mediator that was involved in that.
Thank you. Okay, so I kind of want to redirect everybody.
I think there's a motion on the table and a second.
Second.
Garcia's first, yeah.
Yeah. So, all in favor, say aye.
Aye.
All opposed?
So, I'm sorry, to reiterate, the motion is to send the objection letter and have council present at the LAFCO hearing on March 28th.
Yes.
Thank you. Those are my items. Thank you for your patience.
I actually abstained.
Oh,
You
sorry.
didn't ask that question.
Sorry, I thought I had heard you say aye.
No.
I apologize. Okay. Now we move on to discussion and or action, the presentation of the Kaufman Hall study.
Good evening. This is Jody Hill Michelle. Would you like us to begin?
Sure, go ahead. I was responsible for coordinating the presentation, and on Zoom we have Jody Hills Mitchell and Matt that they'll be presenting the results of the study.
Thank you, Pablo. We'll bring up the study. Does everyone have it in front of them? Or do you want us to put it on the screen?
Yeah, can you put it on the screen, please?
Sure. Before we do, let me just introduce myself and Matt. So we're from the firm of Kaufman Hall. It's a national consulting firm. We do healthcare advisory work. I myself am a managing director, been with the firm over 30 years. And Matt and I both work out of the Los Angeles office. Matt is a coworker of mine, been with the firm, I think about 10 years. Is that right, Matt?
That's right.
And he is a vice president in our Los Angeles office. We had other individuals working on this report from our strategy practice, from our performance improvement practices, as well as our financial planning practices. So we brought together a team to help work with your organizations to come up with a strategic financial plan and an independent assessment, if you will, of the combined organizations. And if you flip to slide 4, Matt, let's start there. Thank you. So we were hired by Preston Hollow, and we were hired approximately a year ago. So the information you're going to see tonight is dated. We were hired about a year ago. We used the data from over the summer. So the data is old. In addition, at the time of the study, we didn't receive fully complete information from pioneers, but we did the best we could with publicly available information. We would be happy to complete the analysis with both more recent information from both organizations, as well as more fully complete information from pioneers. Despite that, we believe the information you're going to see tonight is still directionally correct. So that would be our opinion. And what we were hired to do was put together a strategic financial plan for the partnership. The thesis is that a combined organization in the Imperial Valley with increased scale and synergies, with combined investments and resources, could really better serve the healthcare needs
of the patients in Imperial Valley. So what would be that roadmap which would articulate the key steps to achieving those operational and strategic synergies, and what would be the critical success factors? So what you're about to hear this evening are some excerpts from the bigger report. The first step we did, thank you, Hannah, was interview all the stakeholders. This is a list of the folks we talked with. And as you can see, we tried to talk to everybody and get everyone's point of view. We really wanted to understand where everyone was coming from relative to this partnership. And so we understood the opportunities and the challenges from all different points of view. So that was the first step in our process. The second step in our process was to really take a look at the market and the competitive situation in the Valley. I'm going to go over a couple of these key points, and then we're going to go through a number of the slides that delve into a little deeper these points. So as you all know, your population is expected to age and grow a little slower than the national average over the next 5 years. And that would potentially moderate healthcare growth in the healthcare demand for the Valley. As you also know, the county is composed of about 50% Medi-Cal patients. Molina and HealthNet are the largest payers in the market. Your independent physician organizations in the county do have leverage with both your hospitals. Why is that the case? Is because the physicians work at both organizations, and they also work at other locations in other counties. Both organizations have a large affiliated primary care and specialty network. Right now, you'll see El Centro has a slightly larger affiliated primary care and specialty network compared to Pioneers, but combined it would be even that much greater. In terms of inpatient market share, and what that represents is really how much. Perhaps everyone could mute their line so that we don't have any background noise. Would that be okay? Thank you very much. So in terms of inpatient market share, and that's really how much of the inpatient market do you capture? So Pioneers has approximately 30% in 2021. El Centro had approximately 23%. There's also a significant amount of inpatient outmigration to San Diego. It's primarily to the Scripps hospitals and to UCSD. We'll go into that in a couple of minutes. About 40% of your inpatient market outmigrates to San Diego. Why is that? Really, it's for higher acuity care. And if we did have the resources and the scale and the synergies to really invest in the programs and services in Imperial Valley, potentially those patients would stay in the Valley. And that's really one of the main driving points of coming together. And based on that analysis, and we did this is directional only, we identified several service lines, primarily orthopedics, cardiovascular services, general surgery, and general medicine. And even if we recaptured 20% of the appropriate cases, it could potentially yield for the organization approximately over $4 million in revenue with an $800,000 contribution margin. And that's just using some Medicare figures, because we didn't have access to all the individual figures from both hospitals. So here you have the El Centro and Pioneer service area population, its growth and the aging. And you can see that the growth of the service area right now is scheduled over the next 5 years about 0.2%. The national average is about 0.5%. Your over 65 population is about 1.1% over that period of time. Interestingly enough, on the national side, that's over 2%. So it's growing at a slightly lower rate in total, as well as your over 65 population. On the left-hand side, we have a map, and then we're just plotting the minute drive distance with, from the central part of the populations. On this slide, we just mapped your independent physician organizations. You can see the IPAs and their group names on the left here. And then you can see how many affiliated physicians are both at El Centro and Pioneers. Similarly, underneath, you can see the split between primary care and specialists. So many physicians within the market are affiliated with both organizations. And because of that, no one organization has an opportunity to exclusively partner with an IPA. As you can also see, El Centro has a larger primary care network, and some of these affiliated physicians have practice locations in San Diego and Riverside, in addition to the network. Then we took a look at the FQHC, InterCare. It provides primary and specialty care within the valley, in the county. And these are the number of physicians. So we have primary care, you have 13 primary care docs, you have 5 OBGYN, and most of the independent physicians of El Centro and Pioneers are in InterCare. And they have 8 locations across Imperial County and a total of 20 docs. So this page talks about how much of the population receive care at the different facilities, both in the valley and where they out-migrate to. And you can see, this is when I talked about market share. This is when you see the El Centro market share in 2021, so we had to use publicly available data. For El Centro, it's 23%, and then Pioneers is 30%. So Pioneers is keeping, it has a greater market share than El Centro in 2021. This next slide talks about the payer mix. So, as everybody knows, about a third of the state right now are Medi-Cal members. And so, 73% of your Medi-Cal members stay in Imperial County for care, compared to 54% of commercial plan members. And that's important to know because as we provide services, we need to think carefully about how to take care of all the population. So residents with Medi-Cal do go to El Centro and Pioneers for care much more often than residents with commercial plans. They do tend to out-migrate to the San Diego hospitals for care. The El Centro market share of commercial patients, though, has increased between 2019 and 2021. That's very good news. Unfortunately, we didn't have access to the Pioneers information, but you can see that the El Centro market share of those commercial patients did increase. And lastly, Medi-Cal patients at El Centro and Pioneers, they're most often general surgery, and NICU is called NICU patients. And that's approximately 32%. So really your Medi-Cal patients are out-migrating, mostly they're out-migrating, similar to the commercial patients for high acuity general surgery, cardiovascular, and neurology care. And you can see the hospitals they're out-migrating to. So the low acuity care, and when I say high acuity versus low acuity, hopefully everybody understands that, but the more serious of a disease, it tends to have an acuity factor. They have a rating. So low acuity care patients are rated, it's called 0 to 1 on a DRG basis, moderate is 1 to 2, and then high is 3+. And so we took a look at the distribution, and the low acuity care tends to stay in Imperial County. That makes sense, right? High acuity, you need specialized care. You're going to out-migrate to the San Diego-based hospitals. And like I said before, UCSD La Jolla is the largest recipient of the high acuity cases, of the cases that originate in Imperial County. It provides approximately 45 to 50% of the cardiovascular services. And we, as everyone knows, we don't have an operational cath lab in Imperial County at the present time. So really the thesis, as we talked about, was to really get some of these out-migrating patients to stay in Imperial County. And we want that to happen because we want to really improve the health care that's available to the patients in Imperial County. How do we do that? We really combine our resources, we combine the efficiencies, we invest in the program and services, we invest in the physician recruitment, and that's the thesis in terms of keeping the patients staying home. We identify 4 service lines from El Centro that might make sense to do this: orthopedics, cardiovascular surgery, general surgery, and general medicine. And then what we did when we identified those out-migration patients that could potentially have the acuity level to stay in Imperial County hospitals, then we applied, on the next slide, some dollars and cents to recapturing that out-migration to get a feel for the magnitude of how much money we could potentially keep in our organizations if we were to decrease the out-migration. And you can see, we did it over a phased basis, so if we kept 5%, 10%, 15, 20, 25, and 30, these are the revenues, and then we apply the contribution margin to that. So I'm going to turn it over to Matt. He's going to talk through some of the financial slides. They're going to tie back to some of those out-migration numbers and the recapture, and you'll see how we all try and bring it together at the end to make sense of what it would mean for the 2 organizations with their affiliates to come together.
Thanks, Jody. So the first step when we think about the financial analysis is really to think about what success would look like financially, what targets, how we want to think about targets, how this would need to perform financially to be sustainable long term. So it's a little bit of an art and science to do that, but there are some helpful metrics provided by the rating agencies, which can be a good starting point for kind of thinking through this. So we looked at S&P, the S&P rating agency, some of the medians that they had provided. You can see these listed out here on the slide. They provide medians for standalone hospitals, and then separately for small standalone hospitals, which they define as $150 million of revenue or less. And then across different rating categories. So A-rated hospitals, which will generally have higher metrics relative to triple B medians. Triple B is the lowest rated investment grade rating that they'll provide. And then they have a category called speculative, which would be kind of a sub-investment grade metric. So we kind of looked at these across a few key metrics. Operating margin and operating EBITDA margin, which are a measure of profitability. Days cash on hand, which is a measure of liquidity, just how much cash you have. And then some of the leverage metrics as well in terms of annual debt service coverage and also just level of total debt relative to capitalization, relative to cash. The 2 metrics we really would zone in on here are the operating EBITDA margin and the days cash on hand, as we'll see over the next couple slides. So as we thought about targets, we really put together 2 sets of targets that you can see on the 2 rightmost columns here. Kind of a long-term target, which is really driven in particular by trying to get to that investment grade rating, and kind of where those metrics would need to be. So about 6% operating EBITDA margin, about 150 days cash on hand. Those are kind of the key numbers there. And then we set a kind of a shorter term target as well, just recognizing that both hospitals are a bit from these long-term targets. So just in terms of kind of setting more of a target over the next kind of call it 1, 2, 3 years, a shorter term target at around 3% EBITDA and about 100 days cash on hand. Okay, so the next thing we did was we looked at historically kind of current performance where those targets are relative to El Centro and Pioneer's recent performance. And across the board for each of the metrics, the performance has been certainly below the long-term targets and also generally below the short-term targets as well. El Centro had a negative EBITDA margin in 2023, and then the 2024 they were projecting about 2%. I should note these 2024 numbers they're dated. They're from last summer. So 2023 is for the year ending in June, and then 2024 was the projection was probably in the July-August timeframe that this was put together. So operating EBITDA margin for El Centro of about 2%, and then Pioneer's similar, a negative operating margin in 2023, and projecting a positive margin closer to that short-term target in 2024. With base cash, El Centro finished 2023 at about 15 days, and when we did this analysis was projecting to stay around 15 days in 2024. From what we've gathered, current cash at El Centro is closer to 30 days, and they're projecting that to grow to closer to 60 by year end. Pioneers in 2023 about 44 days cash on hand, projected to grow significantly in 2024, up over 100 days, driven primarily by the DHL loan funds. Okay. So this is just kind of the basis for our analysis. The next thing we did was to really think through partnership scenarios and try to quantify those. So we put together two scenarios here that we'll quantify in the next couple pages. So the first scenario was just an El Centro and UCSD partnership. So the components here would really be El Centro's current performance, any impacts from the turnaround plan and the DHL loan funds. And then Kaufman Hall, our performance improvement team did a deep dive into some of the performance improvement opportunities that would exist at El Centro, both in terms of workforce, so things like labor productivity, premium pay, and kind of what kind of savings could be realized, as well as on the non-labor side in terms of clinical supplies and purchase services. And then we also had an estimate just for the combination between El Centro or partnership between El Centro and UCSD, sort of what synergies could exist both on the revenue side and the expense side. Okay, so that was the first scenario we looked at, and then the second scenario basically took that first scenario and also added Pioneer's. So Pioneer's current financial performance, as well as turnaround plan with the DHL loan funds, and then a number of other opportunities which unfortunately we were not able to quantify as part of this analysis, but we did identify these as key levers here that could continue to kind of play a part in in improving the financial performance. So those items would be standalone performance improvement opportunities at Pioneers, so similar to El Centro on the workforce side, on the non-labor side, what kind of opportunities could exist. And then if you think about a combination between El Centro and Pioneers, some of the service line optimization opportunities that might exist, some of the synergies that could exist in terms of duplicate costs or other savings along those lines, best practices. And then also just between Pioneers and UCSD, if there's any synergies that would exist. And then the last piece would really just be kind of a catch-all for any other funding sources. In particular, things we know would just be if there's an opportunity for additional property taxes or really sole community hospital status from the partnership that can bring in some extra revenue. Okay, so these two scenarios are kind of the ones we put a box around here, and I'll flip to the next page here. We tried to quantify this. So realize this one's a bit of an eye chart and a lot of numbers here, but I'll try to kind of step through sort of what we did and what the key takeaways are. So what's on this page here is a the cumulative sources and uses of cash over a 5-year period. So from 2024 to 2028. Basically, we took that target cash position where we're basically saying in 5 years we want to have cash at 150 days cash on hand. That's the target we'd like to achieve. Given where we are now and kind of the projection that we have, how close do we get to that number? So if you think about the sources of cash over the 5-year time frame, we have, and I'll do scenario 1 here first, and then we'll turn to scenario 2. We have about $7 million of cash on the balance sheet today at El Centro. Received about $28 million from the DHL loan. We have cash flow that will be generated from operations, and we have a little bit of cash that's held just for funding some of the capital expenditures. We also have some of the synergies we discussed in terms of the revenue and expense opportunities with UCSD, the performance improvement opportunities in terms of workforce and non-labor, and then the out-migration mitigation that Jody described earlier. So for scenario one, if you put all those together, it's about $127 million of sources of cash over 5 years. If you think about the uses of cash over that same time frame, to have 150 days cash in 2028, that's about $75 million based on the level of expenses we project that. You'll also have some capital investment. You'll have capital leases, principal payments on existing debt, some working capital. We assumed there would be a need to repay those DHL loan funds over 7 years, so about $14 million of that would need to be repaid as well. And then there would also be some IT capital needed for those synergies with UCSD of about $10 million. So if you put all that together, it's about $175 million in terms of uses of cash versus the 127 of sources. So it's about a $50 million gap, right? It's about $10 million per year that there would be a shortfall to hit that target of 150 days. You do the same analysis for scenario 2. We'll have a higher cash balance to start, given we'll also have Pioneer's current cash balance. We'll have more state funding from the DHL loan. We'll have higher cash flow, and then some of the synergies. We assume, given we weren't able to quantify most of those, those numbers would generally be the same. The one difference would be we did make an estimate for the Stoll Community Hospital status, which would be about $5 million per year starting in 2025. So the sources of cash in that scenario, about $270 million. And then the uses, you would have a larger cash balance needed, given that the expense base is roughly doubled. So you need about $146 million to be at 150 days cash. You'd have a higher level of capital investment, leases, principal, and then state funding needed to repay. So you'd have about $306 million of uses of cash in this scenario. So comparing kind of the sources and uses there, it'd be a total shortfall of about $40 million or about $8 million per year. So it's a little bit lower than scenario 1. They're in a similar range. But as we think about the difference between the two scenarios, there's a lot of items in scenario 2 that could move the needle significantly that we just weren't able to quantify. So that gap of $8 million on an combined expense base of probably in the $200 to $300 million range. It's not a large percentage of the expenses, and if we were able to really realize some synergies there, could probably close this gap comes pretty close to it. Okay, so this is on 150 days cash. We did a similar analysis just using 100 days cash. All the numbers on this page are the same. Other than we set the target cash position to be 100 days, so you need a little bit less cash in 2028 to hit your target. So in scenario 1, rather than having a $10 million gap, that would bring it down to about $5 million. And in scenario 2, we would meet our target, and we would have about an extra $2 million per year, in addition to any of those other items we discussed that we weren't able to quantify. Okay. So I think that's kind of it for the financial analysis. We have some of our conclusions and kind of next steps here. Jody, if you wanted to walk through these.
Sure. Thank you, Matt. So hopefully that crystallizes some of the financial implications of coming together. There's obviously a tremendous amount of potential. In many of those items, we actually weren't able to quantify because we didn't have the data. But you can see directionally, it's making a lot of sense. So from our vantage point, from an independent assessment vantage point, we think there's a real story to be told here. We need to take a look at those additional levers to understand the things that were not quantified to date. We also need to update the report, given that it's over a year old. So, you know, obviously the financial projection analysis is dependent on many, many assumptions, particularly the ability of each hospital to execute operationally and meet their turnaround plan. But it does directionally show that there is a tremendous amount of promise to come together as one organization and really improve the healthcare in the Imperial Valley.
Is that the end of your presentation?
That is.
Do you have any questions from?
Yeah, so this data is taken from about a year ago.
Correct.
Correct, yeah, so it's not actually a true picture, correct? The other question I wanted to ask is, since UCSD has been more or less in the picture with El Centro Regional since 2015, they've actually had the management under the CEO, correct? Do you have a number for the synergies that they've brought into?
Actually, that's not correct.
Oh, okay.
Okay, so we had an agreement to provide some services in 2015 on. We didn't take over full management of the hospital until February of 2022. I'm sorry, 2023. And since,
real quick.
what, pardon me?
Can you identify yourself real quick?
Oh, of course. I'm so sorry. I'm Patty Mason. I'm CEO of UC San Diego Health. So I was just clarifying that we in fact did not have full management accountability for the hospital until February of 2023. And the improvements in the hospital under the leadership of the team has been quite positive over the last year.
Okay, so since 2015, the CEO, Mr. Edwards, was an employee of El Centro, the city of El Centro, or from UCSD?
So he was hired. He worked for the board of El Centro. The board asked us, because they thought they would get a stronger candidate, to be the recruiting agency, which we were. And so in that sense, he sat on our payroll, but he reported to the board of El Centro. He did not report directly to UCSD.
And how long has the UCSD emergency room doctors managed El Centro Regional?
The UCSD El Centro took over in about 2020, I think it was 2015. The emergency department El Centro at the time was being asked by Team Health, who had the contract at the time, for $1.8 million of additional investment to run the emergency department. Our Department of Emergency Medicine physicians stepped up to try to do it without that kind of investment, and have been over many years been able to provide the services at a much less cost point.
And then my other question also too is, what specialty has UCSD brought to El Centro Regional?
Over the years, we have brought vascular surgery, urology, we brought some cancer, we brought some clinical trials, we brought some, obviously, the emergency department. Most importantly, we brought 24/7 critical care coverage for the first time in the Valley, particularly when the first planes were coming in from Wuhan in February of 2020, and we saw what was going to happen. We thought it was important in 2015 to have full 24/7 critical care services in the whole region. We proposed such to both hospitals. There wasn't an appetite to work together to have some scale for 24/7 critical care services. But by the time the pandemic hit, it became critical that we got services in place because of the, obviously the incredible crisis that was not just taking place in San Diego, but is in El Centro and Imperial Valley in general.
So no neurology, no cardiovascular, no orthopedic, and the other specialties that are needed here in the valley were brought from UCSD.
We don't have a cardiovascular.
We don't have cardiovascular.
We don't have a cath lab.
Right.
Typically, you would have a.
Pablo, can you sum up?
Sorry.
So, El Centro Regional doesn't have a cath lab.
Right.
And you would need cardiovascular surgery if you had a cath lab for obvious reasons. You do diagnostic procedures, you do interventional procedures. And in the case of a patient needing open heart surgery, you would need a cardiovascular surgeon and you would need nurses to be trained in surgical. Very high.
Very, very big investment, and to do it as either one or the other hospital wouldn't make much sense. There's cardiology coverage in Valley, though, however.
The other question I have is, since the report's almost a year old, and we have the Lithium Valley plan, I think that our population will most likely grow in the next 5 years versus aging out and not growing. So I think maybe we need to look at that report as well. And I think also too on the population, I mean, they do have a map here, but I don't think they've taken into consideration that we live on the Mexican-California border, so we have a lot of population from Mexicali coming into our valley for care, as well as there's a huge retirement in San Felipe that people seek their care as well. So I think that, those numbers need to be added in here because there's a potential for more work.
It does show some growth, just not as high as the national average.
Right.
Yeah, but you're right, the people that aren't counted in the census projections, those people are not counted in these numbers. You are correct.
Yeah, and then also too, this report was actually just done, I'm looking at, it's not really like on the ground, it's mostly done by data that you got off of the website or by, reporting agencies, correct?
So the data was done by all publicly available sources, and El Centro provided a tremendous amount of information, and so we were able to dive deep into their numbers. Pioneers did provide their, off their website, their budget and their projections for the state loan, but they were not able to provide us anything beyond that.
So I just have a question. So essentially what we would need as a board to finish this study would be Pioneers to cooperate with the data requests that would then come from Kaufman Hall, correct? And then we would need to update it with all the current data. So we can, I think the spirit of this study would be the same, but I think, your numbers are gonna change. And without both parties cooperating and sharing the data, I think it would be a good idea for IVHD to take ownership of this study and then, put the proper NDAs in place so Pioneers could then input their data, because I know that proprietary information would go into it, and then Pablo Centro, both, that way we have a newer study that's owned by this board, everybody feels protected, and essentially everybody working together, so as a community we can have the best data and feasibility study possible to provide, make sure that this merger and AB 918 is successful.
I have something to add to Katie's point, kind of sort of. This study, did it take into account savings from consolidation of services for both entities, El Centro Regional and PMH?
No, unfortunately, we were not able to do that because PMH was not able to give us the appropriate data element. We only got the information for El Centro, so we weren't able, to your point, to do that very important synergy work that is necessary in order to complete the work.
Okay, so you did a lot of work. Would you opine that we'd probably have a lot of cost savings once that happens?
Well, I would hope that that would be the case, but, you know, without seeing the data elements, I wouldn't want to opine to anything.
Okay.
You know, in most situations that we work in where two organizations come together, there are operational synergies, but you'd have to really take a look at the numbers.
So I have a question. Would Kaufman Hall be interested in, you know, working with this board to pretty much essentially update and then finish this feasibility study?
Yes, if we were allowed to receive Pioneer's data, that would be, yeah, that would be essential though.
Okay, I think the direction of this board, we can get the Pioneer's data. Or
So, I mean, AB 918 requires the financial feasibility studies be conducted by Imperial County, LAFCO, and Kaufman Hall. I think it may be more appropriate to negotiate that through an NDA with Pioneers that we would bring back for consideration at the next board meeting as an agendized item. And I'm happy to reach out to Pioneers Council and Pioneer staff offline to discuss the appetite for them to be involved in an NDA so that we could confidentially share information that we could share with our consultant, and that way the protected information would remain confidential, subject to the disclosure of summary conclusions in the Kaufman Hall report. So I'm happy to pursue those discussions if you'd like. I don't know that that this board has the authority to, you know, command Pioneers to do anything. But of course, this board is ultimately going to be the entity that dissolves Pioneers, so, you know.
I think it's important to have an accurate report, and I think I mean, I couldn't make a decision on this report. In fact, I probably wouldn't make a decision on this report with the gaps that are in here. So we definitely need a much better report. However we get it, we need something to make a better decision, because really and truthfully, at this point, I would not agree to it.
I agree. You know, I'm thinking in the case of, you know, what's cost savings. Obviously, like, these reports take a lot of time. They have a majority of the data from El Centro, and I'm thinking it would be most, you know, cost efficient and time efficient to do that. So
Yeah, but I know the ownership of this report is not El Centro Regional.
it's Preston Hollow.
Who's the bondholder for El Centro Regional?
Yeah, and there's actually a representative from Preston Hollow here tonight.
So I don't know, we might want to talk to Pioneers about that as
Well, I mean, we can work that out where Preston Hollow then gives ownership of this study to IBHD. That way it's, you know, nobody else, it's this study then becomes ours.
Okay.
We're just taking the data.
That's the most valuable. I'm Charlie Visconti from Preston Hollow. That's the most valuable.
Can you step up to the?
Oh, sure. Sorry. Charlie Visconti from Preston Hollow. That's the goal. I mean, that was the goal originally.
What's your last name, sir?
Charlie Visconti, Visconsi. That was the goal of the study originally a year ago, is we wanted both parties, and this is before 918 was created, we wanted both hospitals to get together and look at what the economics of it, and as you said, there was only limited data that was provided, so I think it would be, I have to check with my boss bluntly, but I think it's fine to do that and have the district have have ownership of the study and then update it, because I think it's valuable. You know, obviously, we want you guys to be able to use it and most efficiently. So I'll check when I get back in Dallas.
Mr. Wisconsin.
I'm sorry, I have a question. You did one for Pioneers in El Centro in 2020, Kaufman Hall, correct?
Yes.
Yes.
It was right at the beginning of COVID, so COVID sort of skewed,
Yeah. So yeah, it was a 2020 report. Did you use any of that data for this report?
I'd ask Jody, I don't remember. I don't think so, because the data was so old, it was in early 2020. You guys, Pioneers has the report, so, I don't. I don't think it's 4 years old now. I don't think it has any value.
No, I just wondered when you, because this report's a year old, so.
Yeah.
Yeah.
That's why
I
it
just
needs to
wanted
be
to know.
updated.
Okay.
How long did it take you to do the report?
Jody, how long did it take? Sorry.
Hey,
Yeah. We're just the lender. So Jody, go ahead.
probably about 4 months of work, assuming once we get the data. But, that was the first time around. I think we could do it quicker. The data came in more quickly. It just depends on the level of accuracy and access that we get to some of those data elements and talking to the people there. I mean, you have, it's not just data, right? You have to talk to people and understand how things work to make some suggestions relative, particularly to the operating centers.
I have one more question on the report, since we're going to own the report ourselves. I would like to actually have, a different sets of numbers without UCSD totally. Because I mean, at this point, that's a choice that we have to make with the hospital districts. So I would like to actually see where, the three districts, how they would fare, and then you can put the UCSD information in. That's how I feel about that. 3 scenarios.
I don't know if you mean then doing a study on Heffernan as well, is that what you mean?
Well, they're all coming together.
Okay.
They do have.
So I'm in agreement with that. I looked at some of the public information with regard to Heffernan and some of the financial information, and I do have some concerns. I know this is not the time to talk about it, but I do have some concerns about the kind of monies, where they're spending them and what they're spending them for, and their allocations. So if it's possible to add Heffernan to that study, I think it would give us
They definitely need
a
to be
clearer
in the
picture.
study. I mean, it's going to give us a much clearer
Yeah.
picture, because you're going to have revenues from their investments as well. So, yeah.
Yeah, I think what you're kind of referring to, Arturo, is kind of something that we're going to do during our due diligence process, not necessarily during a feasibility study. Because I mean, essentially whether it's acquiring, ECRMC or dissolving PMH and Heffernan to one, like the same due diligence that we would have to do to acquire ECRMC would be the same exact due diligence that we're going to have to do with PMH and Heffernan, because essentially this board's not just, okay, we're dissolving them and we don't know what we have. No, we're going to do the same exact due diligence for everything. Yeah, so I think that's kind of where that comes into play.
Yeah, definitely everything. You're going to have a full inventory. You're going to have everything, what's the word, real estate guy, appraised, appraised, and what we have, exactly. So, I mean, when you're talking in your negotiating team of things, I mean, the first thing you would need to know is the value.
Yeah, exactly. I mean, I think you'll go through all the contracts, everything, everything that goes through. I think you're going to go through, not us, an outside consultant's going to go through everything, all the nuts and bolts of the hospital.
Sorry, really quickly, so that I just don't want to, so that it's clear. The language of AB 918, kind of separating out contracts that each of the respective entities have from the transfer of obligations and rights to this agency. The language of AB 918, before you get ahead of yourselves and task folks with additional work that may be more appropriate for a later date and time, the language of AB 918 requires that, effective on the date of dissolution, the assets, rights, and responsibilities of Heffernan and Pioneers are transferred to IDHD. And as of the effective date of the dissolution, the IDHD has ownership, possession, and control of all books, records, papers, offices, equipment, etc., a bunch of stuff, owned or leased by or connected with the administration for the benefit or the use of Pioneers or Heffernan. And the language of AB 918 also says accounts payable and all other contract obligations shall be transferred to the Imperial Valley Healthcare District. So to the extent that part of the analysis is an evaluation of the underlying contracts that PMHD and Heffernan have, that's not really part of the acquisition right now, because that's not part of the term sheet or negotiations. This board will be absorbing all the contracts that are outstanding, all the liabilities, all the obligations, that happen effective, that exist effective on the date of the dissolution. So I don't know how productive or beneficial it would be, certainly at a later point in time, once IVHD holds all the licenses, is in control, then they can evaluate all of their contracts. But the way that I read this being contemplated right now is everything's just going to transfer over as is. So I just wanted to point that out before we get too far down an evaluation of this, or with or without this, or with or without that.
Yeah, so and I think that also too, that may be an issue as far as like duplication of services. I mean, what's the age of those contracts? Can you term those contracts, or do you have to ride the term out? You know, those are going to be non-cost effective to our board.
Right.
You know, so those are things that, you know, I don't think that were taken into consideration by the author of this bill, unfortunately. And I mean, we have a lot of obstacles in the road that we're going to have to clear out, and it's going to be a major undertaking, because also too, when we merge El Centro Regional into the district, they're going to have almost the same contracts, so it's going to be difficult.
Oh, I don't.
He just fixed the mic. So
I just fixed the mic.
I have a couple comments, if it's possible.
Yes, please.
Okay, just two things. One, as a point of clarification, the only reason that UCSD ended up in the Kaufman Hall report is that there was, because the rest of the data wasn't there, and so I think they were trying to find opportunities for synergy. So whether we're in the Kaufman Hall report or not doesn't, matter to us. I do want to say that, and Jody has said this in the report, but I want to pull this out. You can look at all the costs, and there's going to be synergies, and I think there's a pretty good opportunity within the operations from an operating cost point of view to get everything flowing pretty well. But it's not really where you want to go. I think the opportunity really is that point about keeping patients in the valley, and investments have to be made in order to make that happen. You have patients right now who are leaving the valley to come to San Diego or to Palm Desert to get cancer treatments every day. There's an opportunity to really put a big cancer footprint there. Other clinical services, if everybody's working together, there's scale that allows you to build clinical programs, recruit physicians to build up the valley. And so I don't want to have lost, we can save our way out of it. You can probably save your way out of it and kind of limp along, or you can think about like what the clinical programs that you build are going to be what makes this a really vibrant health system together.
Ms. Mason, I have a question for you. So normally when you do a study, you always, like you guys did, have conclusions and next steps. But are there any lessons learned from your point of view as to how we got in this financial predicament? And part of our mission is to not repeat some of the same financial mistakes that were being made, and also the mismanagement of funds and things like that. I don't know if you can speak to that.
Well, what I would say overall, you can go back and find management mistakes for sure. In the big picture, are they material to what was needing to happen there? Remember El Centro had a 2020 seismic requirement, right? Everybody else is a 2030. But El Centro via the state had a 2020 requirement, which is why the debt was had to be taken down so to get the hospital compliant. By the end of this year, not only will El Centro be EBITDA positive, but it will have a seismically compliant hospital for the long term. So that's a really important asset to the valley long term. That you have a hospital that meets those thresholds that are seismically compliant. And So I wouldn't say, oh, there's a bunch of mismanagement. I would say, where did managers make dumb decisions sometimes? Yeah, probably. But the big picture is, and they got the debt required to build a seismically compliant hospital that was, was required in the 2020 legislation for them, and got it done.
Did you all get to see the turnaround plans from both organizations?
No. Oh, well, but I'm not Kaufman Hall. I don't know Kaufman Hall. I can't speak to them.
That'd be Jody, right?
Yeah, that'd be Jody.
Can you repeat the question, please?
Did you guys have the opportunity to look at the turnaround plans for both entities?
So the turnaround plan for the Pioneers was in their application to the state for the DHL loan. So we just saw the numbers, but we weren't able to interview or talk through with them regarding the assumptions and the underlying, relationships. So we had to take it at face value. So we weren't able to really comment or opine or just anything on it because we weren't able to question it. It was just publicly available.
If I could, at this point, I feel like we're kind of going over the same thing we did at the last meeting where we had a study that was inadequate for what's necessary at this point in time. I think we had a kind of a proposal made by our legal counsel to get the ball rolling, to get this study updated and to work with Pioneers to try and get the necessary information. So I don't know if we need to make a motion to give you direction to go that way, or can we just say, because obviously we need pertinent information. And I'll be honest with all of you, I get a little impatient because time is valuable and we don't have a lot of it, and it's not, it's wonderful to know, but as far as going up forward, we need current, valuable, stable data. So that's my own humble opinion, I'm sorry.
I agree. Yeah, no, I totally agree too. I think, honestly, I kind of sit back and look at why this board got formed, and I think overall you had two hospitals who couldn't get along and agree. You have one study where one person does it, one where the other does it, and now it's like, okay, let's have a mutual board of people get up here and make everybody work together for the benefit of our overall community. I think both reports have kind of said working together is the best way forward for the healthcare of our community. Like everybody, the numbers show so many people leave to get healthcare. And what does that say about our healthcare here? I think we need a healthcare district that we're proud of and hospitals that we trust and can go to. And I think we're only going to get there by working together.
Do we need a motion, or do you just know what to
So the direction I heard was to pursue a discussion with Pioneers to figure out what we need to do, whether it's through an NDA or otherwise, to get the data required to update the Kaufman Hall report. And then the second part of that is request ownership of this Kaufman Hall report from Preston Hollow. Okay, I will pursue that, and I will report back on the progress at the next board meeting, and I will, if we manage to have a governance training board meeting, a special meeting between now and the next regular meeting, do you want me to bring the report to that one and add it to the agenda?
Sure.
Okay, and then if it is an NDA, if that's the route that we can tentatively agree to with Pioneers, then I will bring the NDA for approval at the next board meeting.
Yeah, please step up to the podium.
Good evening. My name is Jose Aldana. I live in Centro. I work for Pioneers. I've been working there for 8 years as a financial analyst. Previously, I worked for Rabobank as the Treasury Management Officer for 12 years. And I oppose this merger, but I think, it's too late, to oppose to it because as the legal counsel mentioned, the bill already passed. I think it was an unfair bill because the people didn't have, a voice to vote on it. And the main reason why I oppose is for what I'm gonna say. I think these projections are kind of correct, but I don't think the issue is a market share opportunity. Now, those numbers that were mentioned here, I deal with numbers. I deal with payers and reimbursements. So I have all the data about Pioneers. And this is public data as well regarding reimbursements and payers. It's Pioneers and Centro, they publish it due to the price transparency law that Donald Trump implemented. Anybody can go on the website and look at reimbursements for each payer. It's nothing new. Regarding the payer mix, yes, our payer mix in the Valley, it's around 60% Medi-Cal, 20% Medicare, and 20% commercial payers, mainly Blue Cross and Blue Shield. For Medi-Cal, mainly California Health and Wellness. Probably, I would say maybe 90% is California Health and Wellness. And then Molina, 5%, and the state Medi-Cal is another 5%. So total about 60%, but again, our bread and butter, it is California Health and Wellness. Now, this projection mentions that 55% are commercial, then supposedly that's the market share that we want to capture, right? Instead of them going over the hill. Well, it's 20% commercial payers. Plus, commercial payers, they pay very well. Commercial, our top payers are, the better payers is Blue Cross and Blue Shield. Again, you can go online, it's public information. Let me give you a good example. We get Pioneers for ENR levels, ER visits, around $1,000. Blue Cross pays that. If you, however, El Centro Regional is getting around $1,600. This is a contract, it's public information, thanks to Donald Trump, right? So, now, think about it. I mentioned this is not a market share issue, and I don't think the population here in Imperial Valley is going to grow. That's why I'm very skeptical about these projections. Now, this is the main issue. That I think the main reason why, even though this is going to go through, but I think it's very important, very critical for the people of the
Sir, your
Centro.
3 minutes is up.
Well, look at that gross revenue. Let me just look at that gross revenue. I expected Central Regional to double the revenue compared to Pioneers.
Thank you, sir.
To conclude that.
Thank you.
Why? Because they are bigger.
Thank you.
And they're not winning.
Keith Bradkowski here, and I have a question for Matt with Kaufman Hall. Matt, I was wondering, in your calculations, are you including the reimbursement rates based on value-based purchasing?
The microphone.
Oh, I'm sorry. Sorry. Matt from Kaufman Hall, the question I had is, in your calculations for reimbursement, are you including value-based purchasing from the various payers based on, quality of care?
We're not doing it, not in a lot of detail. I mean, we're modeling it based on the revenue based on payers, and it's based on the existing contracts and assuming just kind of an overall level of growth for the various payers, just in terms of overall commercial, overall Medicare, overall Medicaid.
But you have to agree that all of the payers are utilizing value-based purchasing as part of their mechanism for repayment, correct?
It's on the baseline for us.
That's right. I mean, we've discussed, I guess, in terms of process. I mean, we discussed all of the assumptions with management and worked with them to kind of develop the approach and the assumptions in terms of how we built the model.
All right. Thank you.
Hello, I'm Carly Loper, CFO Pioneers. Matt, I do have a
Okay, Carly Loper, CFO Pioneers. I do have a question, Matt. The synergies you were talking about in terms of, I think it was maybe on the Epic system or something like that. What year does that hit? Because, they have a 7-year Cerner agreement. We have a 10-year Cerner agreement.
Yeah, I think, so that was an assumption that was provided in terms of the UCSD synergy. There was the $10 million of capital and then the synergy amount, the revenue and expense. Is that the question?
Right, the synergy amount, but so it doesn't hit till we're done with Cerner. We have to put up, say, $10 million to get Epic through UCSD. And then the savings is actually not a savings, because we still have to amortize off that $10 million over a certain amount of years. Is that how you... So we're seeing...
Yeah, the assumption hit in, I want to say it probably started in 25 or 26, and there was a ramp up.
Okay. And then just to note, Papa was not in the mediation that day, so I just want to make that clear.
Yes. I was not at the when the folks met, but I spent about 2 days with retired Judge Pappas in terms of giving him my opinion related to the merger of the entities.
Do we have any other public comments?
I'm really happy to see you have a dilemma with the financials. Okay, the report really didn't show me very much, except something to look at the future. When you have 15 days of cash on hand, that doesn't pay anything. So how are bills being paid up today? It's wise for a facility to have 157 days cash on hand. So how are we all getting along? That must be hard. So finances, I said we would get you finances last time I came up. Okay, we'll get you the finances that you need so we can make sense, so that you can make sense of what's really going on. Because there's nothing there on the retirement fund. There's no there on what your expenses are, like IT. There's a lot of expenses going on Centro. I worked there before. And I know that revenue cycle is not right on. Okay, so if we just hold off on LAPCO, a little bit more time, we'll make the July 1st that your legal wants. Okay, and really look at the number. It's important to look at the numbers so you can have a whole value of what's going on in the valley. Thank you very much.
Do we have any other public comments? Seeing none. Do we have any items for future agenda?
I did have a question about the Kaufman Hall report, the summary report. Could that be made public or without the data? Or how do you guys feel about that? I think some people would like to have that.
It's not ours at this point.
No, I mean in the future.
In the future, I'd be fine with it, but we gotta own it first.
Okay.
Negotiations, but I kind of feel like we need maybe on our next to get a finance committee or some sort of report, because I'm assuming, and I don't want to define that word, but we're starting to commit ourselves to some expenses here with these reports, especially if we're going to own them. So I would kind of like some sort of a accounting of some sort, possibly.
A budget and expense.
Yes, I know Donald is our treasurer, so, yeah.
And if you want also to add the DNO coverage as a general,
Yeah.
they're sending us numbers sometime tomorrow, Monday, and we'll be happy, so we'll be able to make that, put on the agenda, we will approve that.
Does anybody else have any questions?
Oh, I do want to tell everyone that we do have a website now. It's ivy-hg.org, and it has the agendas, it has telephone numbers, has our emails, everything on it. It's a very nice website. I mean, it's new, but it's going to fill up quickly. So, but if anybody wants to know how to contact us, it's on our website.
And I think the bylaws that we're going to bring to, for consideration at the next regular board meeting will address committees, how they're formed, which ones are going to be standing committees, and we can discuss in real time, and you can decide at that point in time, I want 3, I want 1, which ones make sense at this point in time. In the future, we're going to want these kind of committees. So that will be something that's addressed with the bylaws adoption.
Any other comments, questions?
Thank you.
Do we have a date for our next meeting?
We're setting out a doodle poll, and it's the second Thursday in April.
So the date of the next board meeting, of the next regular board meeting is April 11th at 6 p.m. And hopefully before then, we will have a special board meeting to address governance training and potentially update on the progress with PMHD and Preston Hollow. Yeah.
Any more comments from
I do. Lastly, I just want to say thank you to all of you that showed up today and to provide us information so we can sift through all of this. I really appreciate it. I know we all do. So thank you for coming. And bring more people.
With that,